Other conditions I've mentioned, obstructive sleep apnea. This is a treatable condition for refractory cough. That is important, but in hypertension also I have mentioned that this one condition remain undiagnosed in many patients. So be careful about this diagnosis, because treating this condition may help the patient in lot of symptoms, in lot of casualties or calamities, for future calamities, if you treat it well. But this group of patients sometimes use the CPAP, and CPAP sometimes cause some kind of rhinitis where they overuse this nasal decongestant and can lead to rhinitis medicamentosa. So this nasal irrigation, or how you can just keep the nasal area moist with some cream or something, you have to discuss with the patient. Suspected sleep apnea, when you are suspecting, you please organize the sleep test study to find out. Obesity, we all know, and this is the easiest thing to write, that advice weight loss, toughest thing to do for anybody, for the patient, for any of us suffering from that. So definitely you have to be with the patient and tell them, maybe if you reduce your weight, your cough might improve, particularly in GRD patient, that helps a lot. This is again when I'm just left with 4-5 minutes now. So just quickly going through, this is the area where a lot of work are now being done. As I have mentioned you about this afferent, efferent nerves and with the cough, the reason is that unless you know the anatomy, unless you know which part of the body is getting affected, it's very difficult to understand the management and treatment. Now, in cough mechanism, we have seen a lot of receptors are involved in this condition. So irritation of these receptors can induce the cough. And now the scientists are working on those receptors. Whether this receptor, just downsizing this receptor or down-regulating, not downsizing, down-regulating this receptors help with the cough, or if they can cut off the signaling, just like chronic pain syndrome, you know, the drugs we use for chronic pain, like this amitriptyline, gabapentin, even they are using morphine 5 milligram twice daily. The problem is the addiction, problem is the side effects. So these are the drugs, and definitely behavioral strategies, even the physiotherapies, speech therapies, language therapies, they are all involved in this mechanism. In our country, we are lacking in this area. I'm afraid, at least my part of the country where I am working in Kolkata, I can't find this group of doctors or physios which are working in this area, but this really helps. And cough suppressing technique, vocal hygiene technique, some videos in the YouTubes you will find. You can ask the patient to go through it if you just find this behavioral cough problem or this psychogenic cough. I will tell you that.